Hello, this is Dr. Casaros, and in today's video, I would like to talk about face makeovers. One of the earliest indications of bone and muscle loss is jowling of the mid-face. The patient shown here had facial drooping from vitamin D deficiency. Her vitamin D level was 10% of normal levels. Asian people are lactose intolerant and are more prone to vitamin D deficiency. In addition, since we live in a northern latitude and we have long winters and short summers, vitamin D deficiency will occur in 41.6% of patients in this area here. Patients with darker skin tone have higher levels of vitamin D deficiency. About 82% of African Americans have vitamin D deficiency, and 69% of Hispanics or Asian Americans have vitamin D deficiency. Although it is well known that vitamin D deficiency will cause bone loss, osteoporosis, osteomalacia, it also affects other tissues of the body. Vitamin D deficiency will cause muscle atrophy, fat degeneration, and muscle loss. In this side view here, we can see that all we needed to do in this particular patient was lift her soft tissues from the mark shown here to the hairline, which is about 1/4 of an inch of a lift. You can see what a big difference a facelift of 1/4 of an inch lift can make in many patients. If 1/4 of an inch lift is the difference between looking like this and looking like this, then 1/4 of an inch loss of bone and soft tissue volume is all that is required to go from looking like this back to this again. The point is, whether a facelift or some other tissue tightening procedure is performed for drooping or not, we need to also treat the underlying cause of the droopiness. And vitamin D deficiency is a very common cause of soft tissue loss. Other common causes of bone loss include rheumatoid arthritis, chronic renal failure, overactive thyroid or parathyroid glands, type 1 diabetes, nutritional deficiencies of calcium, vitamin D, and inadequate protein levels, either because of malnutrition or malabsorption, such as from inflammatory bowel disease. Aging is a common cause of bone loss, and this is in large part due to inadequate hormone replacement therapy or non-hormone replacement therapy. The patient shown here had a normal vitamin D level but had tissue loss from suboptimal hormone levels due to aging. Even though her bone density scan was read as normal, she has obvious facial bone loss from suboptimal estrogen levels. It is important to realize that bone density scans are designed to show bone loss of large weight-bearing bones such as the pelvic bones, the femur, the thighs, the spine. However, the face has small, delicate bones which lose their volume much earlier than the heavy, weight-bearing bones of the body, as can be seen here. In this case, this patient has droopiness at multiple levels, including her eyebrow, which is why we had to do an eyebrow lift. She also had droopiness of her upper eyelids, which is why we had to do an upper blepharoplasty to remove the excess skin from her upper eyelids. She had obvious bone and muscle loss of her cheeks, which is why she had a facelift with fat and stem cell transfer to her cheeks of about 30 cc's per side, or about 2 tablespoons per cheek. She has obvious bone loss around the mandible and lips, which is why we also added some fat and stem cells there. The patient shown here is a gentleman over 50 years old with permanent heavy wrinkles of his forehead. He also has baggy eyes and volume loss of the mid cheeks, as well as permanent acne scarring around the chin. A mixture of his own stem cells and fat were used to fill the permanent wrinkles of his forehead. He had a subtle eyebrow lift procedure performed, which is why you can see the whites of his eyes after surgery. The bags under his eyes were addressed with a lower blepharoplasty. The loss of mid-face tissue only required a mini facelift in this case. His permanent acne scarring around the chin was corrected with laser resurfacing. Notice how laser resurfacing of the entire skin improves the patient's skin complexion. The aging skin has a splotchy complexion, alternating between dark areas and lighter areas. Laser resurfacing allows for an even complexion of the skin, which provides a youthful appearance. We perform resurfacing of the face with either erbium laser, CO2 laser, or with J plasma. Generally, I recommend hormone replacement therapy or non-hormone replacement therapy for most patients 50 years or older, as well as creatine. I also recommend tretinoin night cream and moisturizer for most patients, regardless of age. Sunscreen for all patients who go outdoors is always a good idea. Other anti-aging treatments that I recommend include Botox or Xeomin for most patients from the eye level or higher. Magnetic light pulse energy, or MLP, can be used to tighten the skin and soft tissues anywhere in the body. There is never a bad time to do MLP. MLP is a walking procedure that requires no sedation and takes about 30 minutes per zone. It typically lasts 3 months, same as Botox, and we will have more to say about this in another video. J plasma is a minimally invasive procedure that uses helium gas to deliver high energy plasma, which causes significant and long-lasting tightening of soft tissues virtually anywhere in the body. Fat transfer to the face is considered mostly a permanent filler, especially when mixed with stem cells. Since fat and stem cells are living tissues, the percentage of cells that successfully take can vary. Typically, 60% of the fat transfer to the face will become permanent and become vascularized with its own blood supply. The take rate can be higher when stem cells are mixed in with the fat cells. Generally speaking, temporary fillers are preferred for small areas such as 1 or 2 cc's for the lips or some wrinkled areas. Using larger volumes for filling, such as a relatively modest 30 cc's of volume for the cheeks, can be cost prohibitive with artificial fillers. 30 cc's of Juvederm would be approximately $18,000. More importantly, large volume artificial fillers cannot match the elasticity and plasticity of normal human tissues. Artificial fillers feel like soft plastic and do not stretch naturally like human tissues do. I find that the semi-permanent or permanent fillers are mainly useful when enough fat cannot be harvested for transfer, such as patients who are severely muscle wasted and have minimal or no fat to transfer. This includes cancer patients, HIV patients, and chronic muscle wasting conditions. For more information about anti-aging treatments, feel free to call or text the phone number shown here. Thank you.